Hello, everyone. Welcome to Wolters Kluwer's Renaissance webinar series, Importance of Oral Histology Concepts in Your Clinical Practice and Dental Research. Our speakers today are Dr. K. Rajkumar and Dr. R. Ramya. Dr. K. Rajkumar is the Vice Principal, Professor and Head, Department of Oral Pathology at SRM Dental College, Ramaouram, Chennai. Dr. R. Ramya is an Associate Professor from the Department of Oral Pathology at SRM Dental College, Ramaouram, Chennai. If during the webinar you have any questions that you'd like to ask, please put them up on the Q&A panel right towards the bottom of the webinar window. It's over to Dr. K. Rajkumar now.
Good evening to everyone. I would like to thank Wolters Kluwer for giving us this opportunity to talk about the book to the students and the faculty. In the first place, I would like to just inform that this book, when it was first launched, as you are all aware, that there was a separate book for oral anatomy and one separate book for oral histology, one for tooth morphology and oral physiology separately. So we thought that we will have one book which comprises of all the 4 subjects. So that's how this book was thought, and that is how we planned for this book. And the other thing is that during that time, the tooth morphology was being taught in different methods throughout the country. So there was no standard protocol for the carving technique. And so when we designed this book, we thought we will have a CD which will cover the carving aspects of tooth morphology also. So in fact, if I think that we will be the first people to have the CD incorporated in the book exclusively for carving techniques. And so when this book was introduced, it was so popular that it was accepted as a standard textbook in most of the dental colleges, and we got a good feedback. And based on that, on the popularity of the book, the publishers requested us to go for the second edition, which we did so in the year 2016. During that time, we introduced 5 more chapters, and then we thought we will have more of applied part of it, applied anatomy, applied consideration, clinical considerations, and applied additional reading to kindle the interest in the minds of the students towards the research aspect. And also a new concept of mind mapping was introduced, which is there at the end of every chapter, which makes it easier for the student to remember instead of mugging the particular portion. So that was there, and also objective type of questions were more in number. That was also added to the chapter, because we thought that objective type of questions are very important to judge a student's knowledge, and therefore it will help them to prepare them for the postgraduate exam as well. So that's how this second edition was launched, and I understand it is very well accepted by the students and the faculty. We get a very positive feedback. Now, today's program, me and my co-author, Dr. Ramya, are going to talk about 2 important aspects of this book. The examination point of view is all discussed, is all very clear in this book, but we thought that we'll discuss about 2 other issues. One is the applied part of it, that is applied clinical consideration part of it, and the other is the research part of it. So I will be more talking about the applied applications part of it in the dental practice, and Dr. Ramya will talk about the research aspect. So now, when any subject for the first 2 years, whatever subject that are there in the dental curriculum, when they are being taught, so the importance should be given to the students to make them understand that this subject is being taught, so that they will have a good foundation in the years to come when they enter the clinical side. So that is how I look at it. So whether it is the preclinical part of it or the theoretical part of it, the foundation should be made so that it makes it more interesting. So in that way, whether it is a student handling the dental plaster or whether they are doing tooth carving, they should know why they are asked to do that, and therefore they should not think merely this as an exercise, but as a learning experience once they understand the importance of the work that they do that in the first few years. So in that way, the oral histology will normally deal about the oral cavity and the craniofacial complex, which contains various tissues, their histological types, anatomy, and their functions. So they have to have an idea about how these tissues, how do they look macroscopically, how do they look microscopically, and what are their functions. So they should understand when we say, for example, when we say the important function of saliva plays an important role in mastication or in speech, or what is the role the tongue has got to play. So when you understand that there is a small ulcer in the tongue, or when there is a lack of saliva, when a person finds it difficult to speak, then they will understand the importance of the functions of the saliva as well as the tongue. So that kind of a clinical correlation should always be there to make the subject more interesting. So in that way, the oral histology, we talk about it. So the first thing is you should know what is the normal histological structures, and then how do they appear macroscopically and the microscopic structure as well. Because I feel for a person to be a good clinician and a successful dental surgeon, it is important that you make the right diagnosis. The treatment plan is one aspect. You have the latest instruments for that. You have the latest materials to do a proper treatment. But if your diagnosis is wrong, all your treatment is not going to be successful at all. For you to make a good diagnosis, you should know the pathology. For you to know the pathology, you should have a good, strong foundation about the histology, the normal tissues. So that's where I'm going to talk about what are the basic tissues that you should know of, and how do they have a consider the applied part of it in their clinical dentistry. Now this photograph shows about the histology and how pathologically the tissues appear under the microscope. Now the next slide. When we go to the proper oral histology, we talk about the tooth morphology. So normally when the students are asked to do the tooth morphology, the carving part of it, they feel, why should they do this? They don't understand the concept of it. So if you're going to carve the crown, you should understand that you should have a strong knowledge about the crown. Only then you can restore the crown. When you're doing a restoration, whether it's a filling or making a crown, unless you restore the tooth properly with a normal occlusal pattern, your occlusion is not going to be proper. If your occlusion is not going to be proper, mastication is not going to be proper, and this kind of improper mastication can lead to TM joint problem. So it is not only the occlusal pattern, it is the proximal contact as well. If the proximal contact is not established properly, it can lead to food particle accumulation, which can further lead to periodontal problems. A student should be told that the reason why they have been asked to know about the crown structure is that is going to play an important role in establishing the normal occlusion later. And I need not have to significantly tell about the importance of the root. So the entire endodontist, the success of a dentist, endodontist depends on how they negotiate the root canals. They should know how many canals it has got, how many openings, and what any abnormal curvature of the root. Everything about the root morphology, they have to be thorough. Only then their role as an endodontist can be successful. So the idea of knowing about the tooth morphology is for this reason. Now we go to the development of the tooth. So this is one other important aspect. In fact, I used to tell my students that once you read embryology or the development of the tooth, you will understand that there is a God, there is a superpower above us. Because for a tooth to develop normally and to erupt normally, having a normal shape and to erupt in the proper thing, millions of events have to take place in the proper sequence. Even if any one of these events do not take properly, they don't happen properly, then the development of the tooth is not going to happen. So you must be knowing that how tooth can develop in abnormal location. So you should understand the significance of that. There is something called neural crest. There are some cells which migrate from the neural crest cells. They are destined to reach the oral cavity and then reach a particular location where they are supposed to interact with the overlying ectodermal cell to cause the dental lamina, to cause the enamel organ, and so on. If these neural crest cells, in case while they are migrating, they go to a different place, they can form tooth somewhere else. Theoretically, it is still possible if you take the ectomesenchymal cell, which are destined to form the tooth. If you are going to place it under the skin, under the epidermis, it is still possible to develop a tooth in the skin as well. So that shows the importance of this underlying ectomesenchymal cells. Now, in case of the development of the tooth, you have the dental lamina. How should the dental lamina form? where at what 10 selective points, where should the enamel organs for the 10 deciduous teeth should form, where should the lingual invaginations happen, and when should the distal invagination happen. Everything is all planned. So if that is not happening in sequence, you can have an abnormal tooth developing in an abnormal location. There was a case report where you had an upper first molar developing in the place of an upper central incisor. So all that is possible. So in there is a lot of molecular factors which play an important role in these mechanism. And so for us to know about the normal tooth development, sometimes you may not have any tooth developing at all. In some condition, you may have lot of tooth which are missing, and more importantly, you have lot of structural changes in the tooth. You can have a tooth which has got an abnormal crown, something like a gemination or a fusion. You can have a tooth which is having an abnormal root. You can have toroidont. You can have a dilaceration. So you should know, when you identify these structures, you should know at what stage in the development of the tooth such kind of a disturbances happen. So that's the clinical significance. And now that you know whether the tooth has got a different crown, a different root, what are its clinical implication? In case it has got a abnormally large root, bulbous root, or it has got a curved root, it plays an important role as far as extraction is concerned, as far as the successful root canal treatment is concerned. If you take the crown, it can have lot of defects. If you have a defects like hypoplasia. So when there is an enamel hypoplasia, that can be an environmental one, it can be a hereditary or an environmental one, it can be due to other causes because of drugs, fluoride, etc. So one should know, once they see a tooth which is discolored, they must be able to differentiate whether it's an intrinsic discoloration, whether it's an extrinsic discoloration, because the treatment for a intrinsic discoloration is going to be completely different for a tooth than rather than a tooth with a extrinsic discoloration. So if you're not in a position to identify that this is an intrinsic discoloration, you will not be able to successfully treat that particular tooth. For that, a sound knowledge about the development of the tooth is important. Next, going to the chronology part of it. Now we will be talking about the shedding pattern of the deciduous teeth, the eruption pattern of the permanent teeth. So that is very important to understand the normal milestones in the growth and development of a child. If a child is growing properly, then you should know whether the development is taking place by looking into the eruption sequence of the deciduous teeth. Similarly, the shedding pattern of the deciduous teeth and the eruption pattern of the permanent teeth also plays an important role in kind of a interceptive kind of a treatment. Your interceptive orthodontist depends only on this sequence of eruption pattern. Sometimes you can have a tooth erupting on the lingual aspect. You should know that developmentally a permanent central incisor, lower permanent central incisor is placed lingually, and sometimes it can erupt on the lingual aspect of a deciduous central incisor, where probably in case you extract the deciduous, the permanent central incisor will automatically come into the position. And then there can be some situations where you can have tooth erupting in abnormal location, giving an irregular pattern, something like an ugly duckling stage. But you should know that this is a phase which will pass off, and as the child grows, the sequence or the tooth pattern is going to become normal. So for you to understand where to intervene, whether to intervene or not, you should have a good idea about the chronology of the deciduous and the permanent teeth. Next, going about the individual teeth structures. I'm just talking briefly about the thing because we are going to talk about the research aspect, which is more important. Enamel. So once you should know that enamel is one structure which once formed cannot form again. And even as on date, there is no material that is as good as enamel which can substitute enamel. So enamel, even though it is very hard, it can be brittle without the support of the underlying enamel rods. And this enamel, the thickness of the enamel is very different. It varies. It is more in the occlusal region, and it should be understood that it is very, very thin, almost knife edge in the cervical margin. So this, the clinical consideration is, this should be, the student should know about the thickness of the enamel. Only then they will be able to tell the patients that they have to have a proper brushing technique, because an improper brushing technique is going to act upon the enamel where its thickness is very minimal and causing the loss of enamel, thereby exposing the dentin and causing sensitivity, which can be a very disturbing problem for the patient. So that is one aspect. The other aspect is about the direction of the enamel rods. So you should know that the enamel rods converge in the region of the pit and the fissure, and that plays a very important role. When there is a caries starting in the pit and fissure, you should know, because of the direction of the enamel rod, the caries, even though it appears small in the occlusal aspect, it can spread over a wider area because of the direction of the enamel rod, deceptively giving an appearance as if the cavity is very small. So the student should be aware of this. For that, you should have an idea about the direction of the enamel rods. And once again, the direction of the enamel rod in the deciduous and the permanent teeth are different in the cervical area, and that should be made, and the student should be aware when they are doing a cavity preparation in the proximal box, how to remove the unsupported enamel, and how should the proximal box be kept in the case of deciduous teeth, and how it should be placed in the case of a permanent teeth. Because even if you use the best material, restorative material available, if you are going to leave unsupported enamel rod by the side of this material, this unsupported enamel rod can crumble under masticatory force, leading to marginal deterioration, and which can lead to secondary caries, and that can result in the failure of the restoration itself. So even if your procedure is good, even if your material is good, if you don't understand this concept of unsupported enamel rod, your restoration is going to be a failure. So all these things they should be understand. And once again, the enamel, it is only because of the higher inorganic content of the enamel rod that you make use of orthophosphoric acid in applying for enamel etching, and that gives a mechanical interlocking to the composite, which adds on to the strength of the composite material. So this applied part of the enamel so has to be taken into consideration. Next, we are going to the dentin. The dentin, you have the pain, the sensitivity, or the most common complaint that any patient with which they come to a dental clinic, and you should know why the dentin is such a sensitive structure, and especially the dentino-enamel junction. Students should have an idea why they keep telling that the cavity, while you are preparing a cavity, the extension of the base of the cavity should not be done at the dentino-enamel junction. It should be done 0.5 millimeter less below the dentino-enamel junction. So you should know the significance of that. You should know what are the different theories which explain the sensitivity of the dentin, and how by blowing air, hot or cold, close to the dentin when you are prepared a cavity, how it can create a pain and sensitivity to the patient. So that all those things have to be taken into consideration. The most important thing about other aspect of dentin is your different types of dentin and the important role that it has got to play as far as all the treatment involving the pulp. You must be aware of all your pulp capping, indirect pulp capping, direct pulp capping, your pulpotomy and things like that. Though they all work on the basic concept of your reparative dentin and secondary dentin. You know what is secondary dentin? So secondary dentin is one which forms after the root completion is over. That's a normal phenomenon, whereas your tertiary dentin is one that you have. Under that you have your reactive dentin and your reparative dentin. Reactive dentin is one that is formed by the existing odontoblast, whereas reparative dentin is formed by the odontoblast which come from the outermost area cells of the pulp, from the pulp. So when you are doing a pulpotomy, when you are placing a calcium hydroxide, you should understand what exactly are you doing. What is this calcium hydroxide going to do? How long should it be placed? Only when you understand the basic phenomenon that happens, how much time it takes for this calcium hydroxide to stimulate the undifferentiated mesenchymal cells of the pulp to get differentiated into odontoblast, and then for them to lay down dentin, then you will understand the procedure of how to do this pulpotomy, whether it's direct or indirect pulp capping and things like that. So for that, for the doing this pulpal treatment successfully, a thorough knowledge about the structure of the dentin is very important. And next we have the oral mucosa. This is very, very important, and you have to have a very sound knowledge about how the normal mucosa looks like and how it can appear during pathological conditions. Not only that, there are so many normal variations which we come across, and we should know how to differentiate a variation in the mucosa from a pathological conditions. I'm sure a lot of people would have handled patients who get so scared of seeing some white patch in the buccal mucosa, thinking that it could be a cancer or something like that. It could be nothing but your 4-day spot. So only when you are able to identify that, only then you can convince a patient there is nothing to be worried about, and this is nothing but a normal phenomenon. Similarly, I have seen so many patients getting scared about blackish pigmentation happening in the gingiva or in any other part of the oral cavity, thinking that it could be a part of oral neoplasm or something like that. So you should know how the different part of the oral mucosa appear in color as well as in texture, and what is this normal physiological pigmentation, when should it be considered as a pathological. So having a sound structure about these structures will help you to differentiate a normal from a abnormal, and a variation also. So only then you will be able to identify this, and then convince the patient more strongly, and then suggest a treatment if at all it is required. So you have oral mucous membrane being affected by tobacco related products. This can be because of smoking or chewing. So you should know how the lesions, tobacco induced lesions, will appear, how will they appear clinically, how will they appear under microscope, and how to differentiate. And there are a lot of other conditions which can also appear in white in color because of fungal infections like candidiasis. So you should know how to differentiate between them. So a thorough knowledge of the oral mucosa, its structure, the color is very important for you to differentiate the pathological conditions. And without that, you will not be able to diagnose this oral mucosal lesions at all. And next, of course, the other aspects, of course, for want of time, I'm not going in detail. There is another thing that we should know about the maxillary sinus, and how the upper first and second molars are in close proximity to the floor of the maxillary sinus, how sometimes a periapical infection can already create an opening into the sinus, and when you are extracting a tooth, how a oral antrofistula can form, or when you are extracting a broken tooth, how you should be very careful in trying to remove a broken root of an upper second molar. Knowing that only when you know the anatomy part of it, you should know that how close it is to the floor. So then you should be able to apply that while you're extracting an upper second molar or whatever it is. So this part of it, understanding the histology, the anatomy part of it, and the other things are very important. And I feel that understanding this oral histology will help you to have a good idea about the pathological cavity, pathological conditions that happen in the oral cavity, and for you to diagnose any lesions involving the mucosal or any conditions involving the tooth, for you to become a successful dentist. So there are a few other things. Of course, for want of time, you're not doing this book. If you see in every chapter, it talks about the applied part of it. So for you to understand each and everything, what is the reason why this particular thing is being discussed in detail, leave alone the theory aspect from the examination point of view, understand, read this other aspect, and see how it applies to the clinical part of it, so that you will also find it more interesting when you read. Now I request Dr. Ramya to take about the research part of it, which is also more important from the student's point of view. Thank you. Over to Dr. Ramya.
Thank you so much, sir. At the onset, I would like to thank Walters Kluwer for having given us such a wonderful opportunity to communicate with the entire faculty and student around India. So the response which this invite, which has been circulating for a quite long time, is something phenomenal. Thank you, Walters Kluwer. And I am Dr. Ramya. And at this particular moment, I would thank Rajkumar sir for having considered me as a co-author in the year 2008 when I joined as a faculty at SRM Dental College. It was that small thing which had really made me work very hard, and thank you so much, sir. It was because of you that the opportunity came, and you were so broad-minded to give it to the most junior faculty at that particular point. And thank you. And I'm here to emphasize on the research aspects of oral histology. So research is actually creation of new knowledge, and it is with research you become a creator, and you have the scope to match the supreme creator himself, who has managed to create this beautiful universe, the awesome planet, and the beautiful lives which we see around us. So if you want to experience the power of creation, do research, pursue research. And that is why I'm here to highlight how beautifully you can actually extract research ideas by just reading a histology textbook. So at this particular point, I would like to emphasize for the juniors or the small, younger students out there to emphasize that please understand the oral cavity is such a beautiful environment, and never ever in any part of the body you have such a beautiful combination. And it is because of this beautiful combination that makes this particular area, offers this particular area a huge scope. So I told you it's a very beautiful environment. So what makes this environment very beautiful? It is a conglomerate of hard and soft tissues, which is not there in other parts of the body. It is not just hard and soft tissues. Immediately, the bones might come inside your mind, but please understand that even though the bones are hard and the surrounding tissues are soft, there is no challenge of the microbial environment as what the oral cavity faces. So we have here the hard and the soft tissues surrounded by the microbial environment. And this particular combination offers a great challenge, but the more challenging things are, the more scope is there for research and the more scope is there for finding out something new. So this is a beautiful conglomerate, and you are blessed to be in such a beautiful field where there is endless possibilities. And this always happens to be a very favorite topic for both of us. And enamel, nothing has matched this beautiful structure till date. You will not believe the amount of research which is happening worldwide. It is not just the histologists who are breaking their heads to find out what is exactly making this beautiful structure. You would be surprised to know the amount of research which is carried out by material scientists, developmental biologists together. So every paper which tries to bring biomimetic enamel is a very big challenge by itself, and you would see that they have just achieved almost just 50%. And this particular topics are there in the additional reading part in your textbook. So that was actually futuristically thought. Even in the first edition, most of the chapters had additional reading, and additional reading was specifically given in this particular book, which made it very unique because it is that would actually make you more creative, and it would make you think that how much of possibilities that every topic could offer. And the second edition again has so many topics of additional reading, and we had actually till the date where it was released, every chapter had up-to-date research events which had taken place. Coming back to mimicking enamel. So mimicking enamel is just copying enamel, copying the beautiful structure which the creator created. Until date, no one has achieved it. So why not you? Please do try. And in case, if you can make a material as good as enamel, please be assured that you would be crossing even Bill Gates. You would become a billionaire better than Bill Gates, because you know why? This particular structure is being thought of not only by dentists. We just don't want just a small filling which would stand for long. It just does not get restricted there. Please understand that bio-inspired materials are the order of the day. High performance material inspired by tooth enamel is being done throughout the world. Physics laboratories are doing it. The advanced nanoscience and technology departments are doing it. Why? Because in case if they really mimic enamel as exactly as it is in the human body, then the same approach can be done in many other approaches, like all engineering divisions, construction agencies, you name anything, the entire thing, your satellites outside, satellites in the technology inside, you name anything, just by doing a biological mimicking of your own enamel, you would actually conquer the whole world. Okay, so it is there in your hands. And this particular slide, this particular research paper which I have cited here just shows a schematic representation of how attempts are being made to repair enamel. Because as already sir said, enamel cannot be regenerated because the formative cells die after producing that beautiful structure. Okay, so because of that, what happens is there is nothing to regenerate enamel. As there is nothing to regenerate enamel, there is a large interest to repair enamel. The first thing which I emphasized was to make high performance materials which would suit any industry. You name any industry, it should suit. The next is coming to our own dentistry, field of dentistry. If suppose a part of enamel gets chipped off, would we be able to just make or regrow that particular part? There are multiple attempts, and this particular schema just is a small attempt of how you can actually try to regrow this beautiful, unique structure. But still, nobody has succeeded. And you would have heard about every tooth, I mean, every advertisement played in the television channel, every, say, maybe 10 minutes, every 10 minutes, there would be one advertisement related to sensitivity. And when does that sensitivity start? So it's all that. So that is the demand, which actually just by mimicking or just copying what nature has given to us, you can become a great scientist and you can become a great researcher. And now coming to sensitivity, as already said, every 10 minutes, any channel you open, you can see a desensitizing toothpaste advertisement. So that is the common prevalence of tooth sensitivity. So why does sensitivity happen? Again, going down deeper than enamel, you have tubes, just parallelly stacked tubes kept inside the enamel, and that is called the dentine. So why is that parallelly stacked? There are reasons for it, because that particular structure had to be hard, and not only hard, it has to be consisting of stimulatory apparatus, that is your nerve tissues, good enough to defend the overlying enamel and defend the tooth as well. So you can see the schema beautifully showing the odontoblast slightly projecting inside, and you can see the yellow nerve fibers which are extending. Of course, there are controversies on how long are the odontoblastic process extending and how long are the fibers extending. Whatever it is, this particular tube is actually suspended in the dentinal fluid, and any change in the dentinal fluid will cause sensitivity. That is basic. So this particular permeability, again, is a very big challenge. And you would start feeling sensitivity right at your college days itself. The first symptom comes when you happen to chew that Cadbury silk chocolate and it hurts. Then everybody came, why so soon I get sensitivity? Please understand, at the age of 18, your first molars have been working for almost 12 years now. So they are getting pretty old. So that wearing away of teeth would easily lead to sensitivity. So desensitizing agents are a very big challenge. There are very good successful materials, but still date, there is no ideal desensitizing toothpaste as well, or there is no ideal desensitizing agent which just you coat it on the tooth and your sensitivity vanishes. There is no material like that. There is no material which fulfills the Grossman's criteria till date. There is no material like that. And then that again offers you huge scope. So you can actually think of a material which would actually find a solution of sealing the permeable dentine so that you preserve the pulp inside. Again, coming to this particular part, regeneration of dentine pulp complex is again a very huge topic. To just simply emphasize, please understand that every caries again is very prevalent. Sensitivity is prevalent, caries is prevalent. So a small caries lesion should be treated on a regenerative mode rather than just filling it by a inert material. So that should be there in your mind always when you're doing a treatment for the patient. So give a base which would actually regenerate the underlying damaged dentine. In case if it is deeper down, you should definitely think of even stimulating the pulp. Again, there are material. You have very good material like MTA now proven, but still they have not completely successful in rejuvenating the dentine pulp complex. The success rates are good, but definitely not 100%. So again, that offers a huge scope of research. And then coming down to the third picture over here, you can see some scaffold, growth factors, and stem cells. So this is for regenerative endodontics. So what does regenerative endodontics talk about? So what is it exactly? So nowadays, there is a shift between the normal routine endodontics, which was actually just cleaning up the canals and filling up with an inert material. No, we want the dentine to be vital and the dentine should not become brittle. So that is the craving right now, and that is how the evidence goes on. So ideally, we would want the dentine to be hydrated and live. So if it is hydrated, the chance of fracture becomes less. The fracture toughness of dentine increases. So for this to happen, you will have to regenerate the dentine pulp complex effectively, and regenerative endodontics actually does this. So what does the endodontist do? Clean up the infected pulp tissue and then tries to induce bleeding. When they induce bleeding, it is just not enough if you just induce bleeding. Ideally, if you can keep a scaffold inside so that it would allow the stem cells there to get triggered and become odontoblast, it would be great. Additionally, if you can throw in some growth factors for growth, it would make a beautiful dentine pulp complex back. So by doing that, your teeth health becomes better. It doesn't deteriorate as what a conventional endodontic therapy would lead to. And now we are moving on to periodontium. This particular area again can be spoken for hours together. I remember Rajkumar sir taking classes for every histology topic. He can talk for 16 hours. But Walter's Kluwer has given us half an hour each. And we were wondering how to restrict ourselves. The entire discussion was to how to restrict and how to hold on. So somehow sir has managed to hold on. So now again, seeing all these topics, even I'm tempted to talk more, but I'll try to finish in time. Okay. So this particular periodontium is a very, very beautifully architectured tissue, beautifully engineered tissue. Why is that statement being given? Because this particular tissue is actually, when you say periodontium, we are actually talking about the cementum, the ligament, and the bone together. Periodontal ligament are just rope-like structures which are connecting the cementum and the bone. Okay, so this beautiful structure offers a hammock-like ligament or a cushion-like ligament, which actually manages survival when we eat anything. The moment you see food, whichever you like, you eat. You even try to bite on a bone. And here in South India, we have some very, very terrifyingly hard snacks, which would really condemn your tooth. Okay, so people in South India would be able to relate. And whatever, the chickies or chuckies, I'm not sure what you say in North India, whatever it is, your periodontium manages. That is because of the biomechanical characteristics of the periodontium. So what happens when there is a disease of the periodontium? There is again a craving, a dire need to regenerate the periodontium. This again is a very, very interesting area of interest with large amount of research groups. And please understand, periodontics is the most preferred field globally because restorative dentistry, as it is called together along with conservative dentistry, it's a most sought after field because till now this particular area is challenged and exact regeneration has not been achieved. This beautiful study, which I have just quoted here, was a publication from 2019 where the researcher has attempted to do an injectable hydrogel kind of regenerative material to bring back the periodontium. Again, if you open and see the graft materials and the regenerative materials in periodontium, there is an endless list. But again, there is till date, no ideal material which would just bring back your periodontium to normal state. So that is what is actually in the periodontal regeneration. Here, I would like to open up another area which would really interest you. Periodontal ligament is also called as an enthesis. Enthesis means a junction where you have the hard tissue and the soft tissue and where there is a biomechanical loading. In case if you are able to master this region, find out all the biomechanical, the perspectives of the periodontium, then you are actually giving into a larger area, opening up a larger area, that is orthopedics. Whatever you can find out with this small region of periodontium, that can be very easily extrapolated to periodontal ligament, can be extrapolated to the orthopedics. Any joint spaces, it is the same enthesis. You just put the word enthesis, immediately joint spaces would open up and not periodontium. But as you go dig in deeper, you would find that periodontal ligament itself is an enthesis, and that if you can master and if you can put a light on that and then cover up everything, whatever is possible. And if you can master this and give up everything, what biomechanical perspectives of this enthesis can give it, and then you are actually opening up a very broad area, that is orthopedics. You know how important orthopedics are. Every person after the age of 35, 40, you know, we get all kinds of back pain, that pain, this pain. It's all because of the skeletal system, the mismanagement of the skeletal system, which usually human mankind suffers. So by being a dentist, by being a dental researcher, you can think of giving ideas to an orthopedician. So that is how you can actually widen your scope. And this is another area which is actually a very favorite area, which I use it to motivate my patients especially. So this oral foci of infection, when I started, I said the oral microbial environment is huge and there are very big challenges which the oral cavity faces. So the bacterial numbers in the oral cavity is in millions, even though if it is going to be a normal pathological flora, whatever, it is in millions. But once there is a shift between the normal to the pathological spectra of microbial flora, that happens when you have a caries teeth, when you have gingivitis. Any small pathology can shift the microbial spectra, and that microbial pathological microbes will not just be simply sitting inside the mouth, and that would be traveling along the circulatory system, and it would be causing lot of problems throughout the body. If you can actually master this particular area, or if you can do research and throw more light on this area, again, the entire medical fraternity would actually be grateful to us, because many times I've had patients sent from the dermatologist telling that the dermatologist wanted the mouth to be checked to be clear of any oral foci of infection, because the dermatologist was not able to find out what is the cause of his skin problem. So what I do, I just go quickly examine the oral cavity, remove every possible infective foci. So that is how it is. So it is at that point we are coming in with a very large impact. And please understand, there are a lot of things which needs to be proven on this particular concept alone. Once you can actually nail down and tell that this is what is happening, and this would cause damage to the entire system, be it your intestine, your joint spaces, your skin, whatever it is because of the spread of infection and the toxins. Now we are moving on to another very interesting area. This actually came inside as a postgraduate student. So whenever we were actually taught about this exfoliative cytology. So exfoliative cytology is a very simple topic where we try to scrape in buccal cells and then we submit it for diagnosis. But please understand, exfoliative cytology is a routine procedure which we do as oral pathologists. But what happens is, till date, your oral exfoliative cytology is not considered as a gold standard. Whereas a similar location down under, that is your vaginal mucosa, the same procedure is conducted as a pap smear. Okay, you would have all heard about pap smear, and that is actually considered for screening, and it is considered very successful or very sensitive than what your oral exfoliative cytology can offer. So why am I telling this? That makes a lot of difference, because the vaginal mucosa is also covered by non-keratinized stratified squamous epithelium, whereas here also we have non-keratinized stratified squamous epithelium. Additionally, we have keratinized stratified squamous epithelium. So that kind of heterogeneity, it is just that it doesn't stop with that. In the keratinized, you have non-keratinized, parakeratinized, orthokeratinized, and so on. Every region, the histological appearance varies. So because of this heterogeneity, already you know that it's a conglomerate, a beautiful conglomerate. Now, tissue-wise, mucosa-wise, it is heterogeneous. That is again challenging, and that challenge is not being met out till date, in spite of so much research activity happening. And that also makes oral cancers still challenging because of this heterogeneity of the oral mucosa. Whereas comparatively, this area, you can actually just ask for a pap test and then proceed with whatever next treatment. Comparatively, the sensitivity is better with vaginal mucosa because it is uniformly the same. The epithelium is the same, whereas it is not the same here. So one diagnostic, the same similar diagnostic procedure is working on another body opening, whereas it is not happening in another body opening. So how can we handle that? How can we make cytology as equivalently reliable as how it is done in your oral, the vaginal mucosa? So these are all areas as how you should keep on thinking and make it more creative, make it more innovative. The more you think wherever you are and whichever point you are, then you become a innovator. You become the creator himself. So please understand the oral cavity has limitless possibilities. Just brush aside the naysayers of dentistry. Please understand that just that oral cavity can be mimicked to be a model for the developmental biologist, for the material scientist in the whole world, and you can dictate term to the construction industry, orthopedics, and so on. So there is limitless possibilities, and we would request all of you to just not read for sake of exams, just not read for the sake of passing out your exams. Put in your heart and soul in reading your subject, and this book actually offers everything what you need to know as a undergraduate in dentistry. And please do read all the additional reading chapters. Once you are done with reading them, try to type in those particular topics in Google and then see what has happened latest, because it's almost 2 years now that our second edition was released. There are so many things which has happened. So that is how you should keep on exploring. As you explore, you would definitely find some very interesting points which you can actually think of, and you can do it by yourself. So please understand, endless, limitless, infinite possibilities is there for you as a dentist. So for you to make best use of it, you will have to be thorough of the fundamentals. As you become thorough of the fundamentals, just read. If you take a chapter, read through the basics, master the basics, and then go into the additional reading part and then see what all can be done. After reading that, you will develop some other ideas and tell it to some well-wisher faculty of yours and try to pursue them. Okay. And these are our contact details. You can actually contact us anytime regarding any help with research ideas and so on. So we are there to help you and guide you with all any queries related to research in dentistry. And not only that, any support related to our textbook, we would be loving, extra willing to help you all out there. And thanks for coming. And thanks again, Wolters Kluwer, for this wonderful opportunity. Thank you.
Yeah, thank you, Dr. Ramya, and thank you, Dr. Rajkumar, for this wonderful session. And like I would request, if there's any question, please put your questions in that Q&A. Till then, like ma'am, I had a small question on behalf of students, though Dr. Rajkumar emphasize on that. So just a small question, like what role does DADH as a subject plays to be a good clinician in dental practice?
Yeah, I think sir would be a better person to answer this.
It's okay, but you can you just ask the question, sir? It was not audible.
Like, so what role does DADH as a subject plays to be a good clinician in dental practice?
Yeah, that's what I told you, sir. See, now the good clinician is to identify the problem inside the mouth. It can be either in the tooth or it can be either in the soft tissues. So only when you know the normal structures, either the hard tissue or the soft tissues, and then only you'll be able to identify the abnormal thing. If you are not able to identify, that's what I told you an example. There can be the normal color of the buccal mucosa is pink in color. You can have a white lesion, but this white lesion can be because of so many reasons. So only when you are able to identify what this could be, if you are not able to diagnose it, then probably you will be just trying one treatment or the other treatment to rule out one condition after another. The patients will lose their confidence. So the good clinician should have a strong foundation in both oral anatomy, that is as far as the hard tissue is concerned and as far as the soft tissue is concerned. Basically, we are dealing only with these two structures. So only when you have a strong foundation, you can identify what is the problem And once you identify the problem correctly based on your foundation, then your treatment is the next thing that immediately follows. So in that way, I feel that DADH, that is oral anatomy and oral histology, plays a very important role in making the right diagnosis, and that I feel is very important then for the treatment plan to follow, sir.
Right. Thank you so much, sir. So I believe we are done for the session, and I would once again thank you to Dr. Rajkumar and Dr. Ramya for giving us such a wonderful session, and we'll be looking forward for more. So thank you so much, everyone, for joining us for the session.
Thank you, sir. Thank you for giving us this opportunity. Thanks.
Okay, thank you.
Hello. என்னப்பா ஒவ்வொரு வாட்டியும் என்னோட பேசே வரலையுமா ஸ்கிரீன்ல இந்த வாட்டி நான் வந்து அப்பா ஐயா இதெல்லாம் கதை உன்னோட இல்ல இப்போ எனக்கு என்னோட பேஸ் வந்து தெரிஞ்சுதா இல்ல